I've had a baby and I want to get back to running. Where do I start? Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. So, where do we start when somebody has had a baby and they're not quite sure if they're ready? Like, how do we know that? We do something here at the Healing Spot that is a return to run screening tool. So, what it is basically it takes us about 45 minutes to an hour to get through. It's 10 tests ranging from 30 seconds to a minute, and we actually check things like your strength, your tolerance for impact, and also your balance, because so many things change during pregnancy and postpartum that we want to make sure that your body is ready to handle something like going out for a run. So a lot of women are just told, listen to your body, or they're led to believe, or they think their own mindset is, hey, I'm going to be completely healed at 6 weeks. So they wait that 6 weeks and then they're just like, go on out and just start running. And for some women, maybe that's okay. But for a lot of women, that's not okay. They run into things like pain, or they start their body just doesn't feel quite ready. They don't feel like they're strong enough, and they don't know what to push through and what to stop. And there's a lot of say in between there, between stopping the exercise altogether and not doing it, and just kind of pushing through things. What's the happy medium there? So, what do we actually look at? Again, we're going to look at strength, your balance, and your impact tolerance. And those can tell us really how well you're going to tolerate running. And then from there, we can give you guidelines on, what's appropriate. Is it going to be, say, go out for a walk? I would suggest doing that, obviously, before just going out and running. Um, but what does that actually look like? Is it intervals between, say, some walking and jogging? What does that actually look like? If there are any deficits in strength or balance, or you're not tolerating impact, again, there's a lot of, say, wiggle room between not being able to do anything at all and just kind of blowing through your body's tolerance for it, and those signs and symptoms that it may be giving you that it's not tolerating it very well. So this return to run screen gives us a really good tool that we can check baseline, meaning like, where are you at right now versus where you actually want to be. And it helps us to kind of make the stepping stones to help you get to your goal. One of the things that we're looking for is your tolerance right now. And we use the screen tool, and basically we're seeing, are you passing, or are you failing? And I use failing. It's not like, oh no, you really can't do that at all. It just means that, hey, there's some signs there that we need to modify this. One thing that we talk about during the screening is a threshold. So basically, let's say we're doing a wall sit, for instance, and we're checking strength of the core and the legs, and the test is for a minute. And maybe at 25 seconds into it, you are feeling one of the signs or symptoms that we're looking for to let us decide that, hey, we need to stop this because you've reached your threshold. It's like your check engine light coming on in your car, just saying, hey, there's a little bit of a problem here. Please pay attention. So we call that a threshold. So let's say 25 seconds is your threshold where you're symptomatic. Well, then what we do is we take that information, we say, okay, you're symptomatic there. We want to train down here. So we want to modify that exercise in some way so that you can still do something that's moving you towards building core strength, building leg strength, but it's done in a way where your body's not screaming at you. And if we stay below this threshold and we train there, what will happen is that threshold would change. You'll get better, and then we can bump you up a little bit, right? But if we ignore that threshold and your body's saying, hey, 25 seconds is where I'm getting that check engine light on, and you go ahead and push through that and you ignore that, what's going to happen is, best case, that threshold is going to stay the same. It's going to always give you that same kind of warning light. But it could actually, most times, it will actually go down where it starts talking to you sooner and saying, okay, fine, you're not going to listen to me, I'm going to start giving you signs and symptoms earlier. Okay. So what are the signs and symptoms that we're looking for when we're doing this test? There's three things that I always tell my clients that I want them to pay attention to and tell me about. One is pain anywhere. I know I'm a pelvic floor physical therapist. This is the main part that I treat, but I look at all of my clients, my patients, as a whole person. So if you have pain anywhere, that's a body signal that, hey, something's not working right. The other is pelvic pressure. So any heaviness, bulging type sensation down into the pelvic area, we want to pay attention to that. The third thing that we're looking for is any incontinence. And with that, that's urinary incontinence, so any leaking, any dribbling, but it's also fecal incontinence. So that could be, some smearing or feeling like you're gonna, have an accident in your underwear, or it can even be loss of gas without meaning to. Okay, so those are the three things that we look at. And I use those as guidelines, not only with this test, but really to help moms determine if they're tolerating their exercise programs adequately. And that's something that you can pay attention to right now. If you're exercising, you've had a baby, and you're listening to this, pain, pressure, and incontinence are three signs that you want to pay attention to. And again, it may not necessarily mean that you can't do the exercise if you're having it. It just means, hey, pay attention and modify, change, make it a little easier for yourself. And there's a lot of ways to do that, which I'm not going to get into on this video. All right, so let's get started. I'm going to show you some of the screening exercises that I do in this return to run screen, and kind of some of the things that I'm looking for when I'm doing this. One thing we look at is a wall sit. So basically feet out away from the wall, sitting down to about 90 degrees, and this is a 1-minute test. So we're really looking to see what's that core and leg strength to be able to do something like this. To check impact tolerance, we do a hop in place. So we do that 2 feet at a time. Okay, we also do it 1 foot at a time. So the 2 feet one we do for a minute, and the 1 foot one we do for 30 seconds each side. We also do a run in place, okay? And I'm showing you this just kind of at whatever pace, but I actually measure this and have you go at a certain rhythm, certain pace, okay? And we're looking to see, again, pain, pressure, or any incontinence. Another thing we look at is one-legged balance to see how well the hips stabilize so that you can actually go out and do some running, okay? I like to do that eyes open as well as eyes closed because it really tells us a lot more about the body. So this isn't all the things that I look at, but it gives you a pretty good representation of some of the things that we do during this screening test. So if you're postpartum and you're like listening to this and you're thinking, you know what, I need a little bit of help, I need a little bit of a guidance, please reach out here to us at the Healing Spot. The best place to go is head to our website, healingspotpt.com, and check out our postpartum tab. You can do the screen all on its own. It's a service that we provide, and we can set aside an hour with you, and we can go through all of these tests and find out exactly what you're doing and what you want to be able to do. Or if you come in as a patient and we're seeing you for some postpartum recovery, this is something that we can do in one of your sessions. So we do have some variability with that. We'd love to hear from you, answer all of the questions that you have. So reach out to us today and we'll see you soon.